It was just a cup of tea. That's what Margaret, 72, told her daughter after she dropped it. She had reached for her favorite blue mug, something she'd done 1,000 times before, but this time, her fingers didn't quite grip. The cup slipped, shattered. She laughed it off. Guess I'm just getting clumsy in my old age. But what Margaret didn't know, what most people don't know, is that in that small moment between the slip and the smile, her brain was whispering a warning. And 2 days later, she collapsed. Every year in America, nearly 800,000 people have a stroke. And here's the shocking part. In up to 85% of those cases, the body gives off early warning signs, but most people don't recognize them. Or worse, they ignore them. Because it didn't hurt. Because it only lasted a minute. Because we tell ourselves, it's nothing. Until it is. In this video, we're going to walk through 10 early signs your brain may be warning you about a stroke. The science behind why they happen and what makes them so easy to miss. And most importantly, the real stories of people just like Margaret, who listened or didn't when their bodies spoke up. Because after 60, staying healthy isn't just about eating right or exercising more. It's about staying informed and knowing what to do when seconds count. Maybe you're here because you felt something strange recently, a sudden tingle, a moment of confusion, a dizzy spell you can't explain. Or maybe you're watching for someone you love, a parent, a spouse, a friend who's just not quite themselves lately. Wherever you are, this message is for you. Because stroke doesn't always begin with sirens. Sometimes it begins with silence. Let's make sure we never miss the signs again. It started with a spoon. Ronald, 68, was having oatmeal, like he always did. He reached for the spoon with his left hand, but fumbled. It slipped out. Then again. The third time, he switched hands and thought, maybe I just slept on it funny. He didn't feel pain. No dizziness. No real weakness. Just a strange sense that something wasn't quite right with his fingers. He ignored it. 2 days later, he was in the ICU. What's really happening inside the body? That weak grip, that lazy hand, might seem like nothing, but it could be one of the first signs that your brain is struggling to communicate with your body. During a stroke, blood flow to a part of the brain gets blocked. When that blockage affects the motor cortex, the area responsible for movement, you may feel weakness or numbness, often on one side of the body. Here's the key. The left side of your brain controls the right side of your body, and vice versa. So if you suddenly have trouble holding a fork, tying your shoes, or brushing your teeth with one hand, it may not be your hand at all. It may be your brain calling for help. According to the American Stroke Association, over 70% of stroke patients report sudden weakness or numbness, often in just one arm or leg. And in a 2019 study from the Lancet Neurology, people who ignored early symptoms like hand numbness were 6 times more likely to experience a major stroke within 48 hours. Even more troubling, seniors often don't feel pain when these symptoms appear, making them easier to dismiss or mistake for just aging. Clara, 75, from Ohio, thought her left foot felt cold. She bundled up, thinking nothing of it. An hour later, she dropped her spoon at breakfast. Her husband remembered a video on stroke signs just like this one and called 911. She received treatment within 90 minutes. Today, Clara plays piano again, because they listened to something as small as a spoon. Here's the truth. Stroke doesn't always knock the door down. Sometimes it taps your shoulder or your fingertips. If you or someone you love suddenly can't lift one arm evenly, feels numb on one side of the face, or drops something for no clear reason, don't wait. Don't hope it passes. Call 911. Because when it comes to stroke, time lost is brain lost. What if you can't find the words? What if your sentences come out jumbled even when your mind feels sharp? Let's talk about the second sign, how your speech can quietly warn you long before your body gives in. It was just a bedtime story. Robert, 68, was reading to his granddaughter something he'd done hundreds of times. But this time, something was off. He got stuck on the word princess. He repeated it, then slurred it. His granddaughter looked up and said, "Grandpa, that didn't sound like you." Robert laughed and said, "Guess I'm just tired." But his words came out jumbled, like letters rearranged in the wrong order. That small moment, that tiny glitch in his speech, was actually the first sign of a stroke in progress. What's going on inside the brain? Our ability to speak clearly, to choose words, form sentences, and understand what others say is controlled by language centers in the brain, mostly in the left hemisphere. During a stroke, if blood flow is cut off to these areas, even for a few minutes, the brain can't send the right signals. That's when words slur, sentences get jumbled, or nothing comes out at all. You might know exactly what you want to say, but your mouth and brain aren't on the same page anymore. And that mismatch, it's not just frustrating, it's a neurological emergency. According to a 2021 study in Stroke, a journal by the American Heart Association, more than 30% of stroke patients experience sudden trouble with speech in the first hour of a stroke. And here's the critical part: patients who get medical help within 3 hours of their first speech-related symptom are far more likely to recover fully, with little or no long-term damage. But when people dismiss it when they say, "I'm just tired," or "maybe I'm dehydrated," the clock keeps ticking and brain cells keep dying. Robert's story didn't end in tragedy because his granddaughter remembered a school lesson on stroke signs. She asked him to say, "The sky is blue." He tried. It came out, "So sky blue." She didn't hesitate. She called 911. Doctors confirmed a mild ischemic stroke, caught just in time. Today, Robert still reads bedtime stories. And sometimes, he tells the story of how his granddaughter saved his voice. Here's what to look out for: sudden slurred speech, mixing up or forgetting simple words, trouble understanding what others are saying, or saying things that just don't make sense. Even if it lasts just a few minutes, even if it gets better, don't wait. Because in stroke care, every minute counts. What if your words are fine, but your vision suddenly changes? You're reading, and the lines go blurry. You're watching TV, and part of the screen goes black. In the next part, we'll talk about the quiet stroke warning your eyes may see before your brain even knows something's wrong. Lorraine was baking cookies when it happened. She reached up to grab the cinnamon, and just like that, her left eye went dark. She blinked, rubbed it, looked around. After a minute or two, the darkness lifted. Everything seemed fine again. She thought, maybe I rubbed my eye too hard, or maybe it's just my age. So she finished the cookies. She didn't mention it to anyone. The next day, it happened again, only worse. And this time, it didn't go away. What's actually happening? When people think of stroke, they often imagine slurred speech or drooping faces. But one of the earliest and most overlooked warning signs is sudden vision changes, especially in just one eye. This can feel like a grey curtain falling over your vision, a sudden blur or double image, trouble seeing to one side, or even a full loss of sight in one eye. But here's what's important. It's not always your eye that's the problem. It's your brain. Your optic nerve and visual cortex, the parts that help you see, rely on steady blood flow. If that flow is interrupted, even for seconds, your brain can't process visual input. That's why everything goes fuzzy, or missing, or strange. According to the American Academy of Ophthalmology, sudden, painless loss of vision in one eye is often a sign of a retinal artery occlusion, essentially a stroke in the eye. And the National Eye Institute warns 25% of people who experience this kind of vision loss will have a major stroke within 7 days. Even if your vision returns, the clock has already started ticking. When it happened the second time, Lorraine's daughter insisted on taking her to the emergency room. Doctors discovered she had suffered a mini-stroke, a transient ischemic attack in the part of her brain responsible for processing vision. Because they caught it in time, they were able to begin treatment and prevent a full-blown stroke just days later. Lorraine now says, "It wasn't my eye. It was my brain trying to warn me." If you or someone you love suddenly experiences blurred vision, seeing double, partial, or full vision loss in one eye, trouble reading, focusing, or bumping into things, or sudden difficulty seeing to one side, don't wait for it to clear up. Don't assume it's just tired eyes. Call 911. Let doctors decide what's going on. Because sometimes, your eyes know first. You're standing in the kitchen, then the room tilts. Your legs feel shaky. You reach for the wall. Was it just a dizzy spell? Or is your balance trying to tell you something far more serious? In the next part, we'll talk about sudden dizziness and loss of coordination and why they may be your brain's early cry for help. William had just finished watering the garden. As he stood up to stretch, the world tilted. The flowers spun. He stumbled, reached for the fence, and laughed. "Who you?" Maybe I stood up too fast. His wife brought him some water. He sat down, and the dizziness faded. But 20 minutes later, as he walked back inside, his right foot didn't land quite right. Then he swayed off balance and nearly fell. That's when his wife said, "We're not guessing. We're going to the ER." She saved his legs, maybe even his life. What's really going on inside the brain? Balance isn't something we often think about until it's gone. Our sense of balance and coordination comes from a part of the brain called the cerebellum, located at the back of the skull. This area works with our inner ear, eyes, and muscles to keep us steady, upright, and moving smoothly. But during certain types of strokes, especially those in the posterior circulation, blood flow to the cerebellum is disrupted. The result: sudden dizziness, loss of balance, trouble walking, or that scary sensation that the floor is shifting underneath you. What makes it more dangerous is that these strokes are often mistaken for fatigue, dehydration, or even a minor ear problem. But inside your brain, something much more serious could be happening. According to the American Stroke Association, over 40% of patients with strokes in the back of the brain report dizziness or imbalance as their first symptom. And yet, a study published in Stroke found that 60% of these cases in older adults are misdiagnosed on the first visit, often labeled as vertigo or inner ear issues. But here's what's truly alarming: delaying treatment by just a few hours in these cases doubles the risk of permanent disability. Doctors found that William had experienced a cerebellar stroke. It wasn't from standing too fast. It was from a clot blocking the back artery of his brain. Because his wife trusted her instincts and took him in quickly, he received treatment within the critical window. Today, William still walks his garden path steadier than ever. Pay close attention if you or someone you love experiences sudden, unexplained dizziness, difficulty standing or walking, feeling like the world is spinning or swaying, trouble reaching for objects or coordination issues, or falling without an obvious reason, even if it passes quickly. Even if you feel okay after, don't brush it off. Don't wait. Call 911. Because when your balance slips, it might be your brain's way of calling for help. Headaches happen all the time. But what if it's not just a headache? What if it comes on suddenly like a bolt of lightning, sharp, intense, and nothing like you've ever felt before? In the next part, we'll talk about the kind of pain you should never ignore and how one headache could be the only warning your brain gives. Angela was doing her crossword puzzle when it hit. A blinding ache. Sharp, sudden, like someone flipped a switch and poured lightning into the back of her skull. She froze, closed her eyes, tried to breathe through it. "I must be dehydrated," she whispered. She tried lying down, but minutes later, her speech began to slur. Her daughter didn't hesitate. She called 911. Angela had experienced a hemorrhagic stroke, and that headache, it was the only warning her brain gave. Most strokes are ischemic, caused by a clot blocking blood flow, but in about 10 to 15% of cases, strokes are hemorrhagic, caused when a blood vessel in the brain bursts. When this happens, blood leaks into the surrounding brain tissue, creating pressure that builds rapidly. That pressure is what causes the sudden, explosive pain. This isn't your average headache. It's not gradual, not familiar, not something you push through. Victims often describe it as the worst pain of my life. Like a bomb went off in my head, like my skull was about to burst. And here's the critical part. This may be the only symptom. No numbness, no slurred speech, just pain and then silence. According to the National Institute of Neurological Disorders and Stroke, nearly all hemorrhagic strokes begin with sudden, severe headache. A study in the New England Journal of Medicine found that over 70% of older adults described it as unlike anything they'd ever felt before, and the danger. Delaying care by even 30 minutes can increase the risk of death by more than 50%. Because every second the brain bleeds, more tissue is lost, more pressure builds, and outcomes get worse. Thanks to her daughter's quick reaction, Angela was rushed to the hospital and received care before the damage became irreversible. Doctors managed the bleeding with medication, no surgery needed. She made a full recovery. Now, when people mention migraines, Angela gently tells her story. If it feels different, don't assume. Just go. If you suddenly feel a headache that is explosive or sharp, intense within seconds, paired with nausea, vision changes, or confusion, and has no clear cause, no fever, sinus pressure, stress, or hunger, don't lie down. Don't wait to see if it passes. Call 911, because sometimes the brain doesn't whisper, it screams. And when it does, you must listen. You're at the grocery store and suddenly, nothing makes sense. You forget why you're there. Someone asks you a simple question, and you can't find the words. It's not just forgetfulness. It could be the brain's way of saying, I'm in trouble. In the next part, we'll talk about sudden confusion and why it's one of the most easily missed signs of stroke in older adults. Henry had made coffee the same way every morning for over 40 years. But that day, something was off. He stared at the machine, reached for the filters, then paused. He looked at the coffee grounds and forgot what came next. His wife walked in and asked, "Everything okay?" He looked at her blankly and said, "Where are we going again?" At first, she thought it was just a senior moment. But within the hour, Henry couldn't remember the names of their grandchildren. They called 911, and that decision changed everything. What's really happening in the brain? We all have occasional lapses in memory, forgetting a name, losing our keys. That's part of aging. But sudden confusion, the kind that clouds your thinking, scrambles your words, or makes familiar places feel strange, is something else entirely. When a stroke affects the frontal or parietal lobes of the brain, areas responsible for reasoning, judgment, and memory, even simple tasks can feel impossible. You might forget what you were doing, feel lost in a place you know well, be unable to follow a basic conversation, or say things that don't quite make sense. It can feel like your brain is suddenly working in slow motion, or like the piece. A 2018 study in JOMA Neurology found that over 25% of seniors who experienced a mild stroke reported confusion or disorientation as their first noticeable symptom. And according to the American Stroke Association, strokes in the right hemisphere, which often go undiagnosed longer than left-side strokes, frequently lead to cognitive fog, poor judgment, and even sudden personality changes. In older adults, especially those with memory issues, this kind of confusion is often mistaken for dementia fatigue, delaying crucial treatment. At the hospital, doctors discovered that Henry had suffered a small ischemic stroke in his frontal lobe. Because they caught it early, treatment began within hours and his memory returned within days. He was lucky. Now, every time he makes his coffee, he smiles and says, "Still brewing strong." Be alert if someone seems suddenly confused or disoriented, can't remember where they are or what they're doing, struggles to understand simple instructions, says things that feel out of character or strange, or seems mentally foggy without explanation. Don't chalk it up to just aging. When the brain starts sending mixed signals, that's your cue to act fast. Because confusion isn't just a mental slip, it could be your brain's last quiet plea for help. You try to walk across the room, but your foot drags. You reach for a glass, but miss it. You button your shirt and realize your hand isn't working the way it should. In the next part, we'll explore how sudden changes in movement or coordination can be one of the clearest, yet most easily dismissed, signs of stroke. Leon always walked his dog Rufus every morning. Same street, same time, same warm cup of coffee waiting for him after. But that morning, something felt wrong. Halfway down the block, he noticed his right foot dragging. He tried to lift it, nothing. Then he stumbled into a fence, confused and embarrassed. A neighbor rushed over. Leon insisted he was fine, but she saw the fear in his eyes. She called 911. That decision meant Leon would walk again on his own terms. What's happening inside the brain? We often think of walking as automatic, but behind every step is a complex dance between your brain, nerves, muscles, and joints. The motor cortex, cerebellum, and brainstem all work together to send smooth, coordinated signals. When a stroke affects these areas, that communication breaks down. The result, dragging one foot, unsteady steps or wide stance, clumsiness in the hands, trouble with fine movements like buttoning a shirt or holding a fork. And here's the tricky part, it might feel mild. You might think you're just a little off that day, but inside, your brain could be struggling to move your body at all. According to the National Stroke Association, over 35% of stroke patients over age 65 report sudden difficulty with walking or coordination within the first 30 minutes. And a 2021 study in Frontiers in Aging Neuroscience revealed that slower steps asymmetrical walking, or a wider stance were among the first signs of stroke in older adults. But here's the danger. Many of these patients were initially misdiagnosed, told it was arthritis, fatigue, or just aging. That delay, it cost them time. And in stroke care, time is everything. Leon's scan showed a mild ischemic stroke in the motor region of his brain. Because help came quickly, doctors administered clot-busting medication within the golden window. 2 weeks later, Leon was walking Rufus again, this time a little slower, but stronger than ever. Now, every time he feels his stride, he says to himself, "I almost ignored it. I'm glad I didn't." If you or someone you know suddenly drags a foot or can't lift a leg properly, feels off balance without explanation, has trouble coordinating hands or fingers, drops things or fumbles during simple tasks, or sways while standing still, don't assume it's arthritis. Don't write it off as just being tired. Call 911, because that invisible tripwire could be your brain saying, "I need help now." What if all of these signs, numbness, speech trouble, dizziness, confusion, come and go? What if they vanish before you even decide whether to call for help? In the next part, we'll talk about the mini stroke most people miss and why ignoring it might lead to a full stroke within days. Elaine was brushing her hair when her left arm suddenly felt off. Not paralyzed, just weak. She couldn't lift the brush for a moment. A few minutes later, her arm worked just fine again. She didn't tell anyone. It was probably nothing, she thought. That night, she had no other symptoms. She went to bed. 2 days later, she woke up unable to move the entire left side of her body. Elaine had a major stroke just 48 hours after the mini one she didn't know she'd had. It's called a TIA, a transient ischemic attack. It happens when blood flow to part of the brain is briefly blocked, usually for just a few minutes. Because it clears quickly, the symptoms go away. But here's the truth. A TIA is not nothing. It's not harmless. It's not a warning. It is the warning. The only difference between a TIA and a full stroke is how long the blockage lasts. But the damage it predicts, that's very real. According to the American Stroke Association, 1 in 3 people who experience a TIA will have a full stroke within a year. And up to 20% will have that stroke within just a few days. The tragedy is that many TIAs go unreported because symptoms disappear so fast, leaving people falsely reassured. They might experience sudden numbness, slurred speech, vision trouble, dizziness or confusion, then feel fine again in 10 or 20 minutes. But inside the brain, the clock has already started. When Elaine arrived at the hospital after her second episode, doctors reviewed her scans and found signs that she'd had a TIA 2 days earlier. If she had come in after that first event, she could have received preventive treatment, medication, imaging, monitoring. But she waited. And the second time, her brain didn't bounce back. With rehab, Elaine regained most of her movement. But she now tells everyone, if your body tells you something, don't wait for it to yell. If you or someone you love experiences any sudden stroke-like symptom that lasts just a few minutes and then goes away, don't dismiss it. Don't wait for it to happen again. Go to the emergency room. Ask about a possible TIA. Let doctors check your brain, your arteries, your heart. Because the second chance that a TIA gives you, it's often the only one you get. Now that we've covered the signs your body gives you, let's talk about the things that put you at risk in the first place. In the next part, we'll look at the hidden stroke risk factors most seniors ignore and the simple steps you can take to protect your brain, starting today. Tom always thought he was in pretty good shape. He walked every morning, didn't eat much fried food, and only had the occasional glass of wine. So when his doctor told him his blood pressure was 160/95, he laughed and said, "That can't be right. I feel fine." He never took the medication. 6 months later, he had a stroke while raking leaves in his backyard. The truth is, feeling fine doesn't mean you're not at risk. And for many older adults, the danger is silent until it's not. Why risk doesn't always feel like risk. Stroke doesn't only come from dramatic symptoms. It builds silently over time through chronic conditions that damage your blood vessels, especially the ones feeding your brain. Some of the biggest hidden culprits are high blood pressure, hypertension, the #1 cause of stroke, atrial fibrillation, an irregular heartbeat that causes clots to form, type 2 diabetes, which damages the inner lining of arteries, High cholesterol, which leads to plaque buildup in the vessels. Smoking, which narrows arteries and raises clotting risk. Sleep apnea, which starves your brain of oxygen during the night. And even chronic stress or loneliness, which increase inflammation over time. These don't always cause pain. They don't always show up on the outside, but inside, they quietly raise the odds that one day a clot will form, a vessel will burst, and everything will change. According to the CDC, 77% of people who have a stroke have high blood pressure. People with atrial fibrillation are 5 times more likely to have a stroke. And those with diabetes are twice as likely to suffer one. But here's the most hopeful part. Over 80% of strokes are preventable when we know the risks and act early. After his stroke, Tom committed to change. He started checking his blood pressure every morning. He cut back on sodium, walked with a friend every evening, and finally took the medication he once ignored. He hasn't had another stroke. And when asked what he wishes he'd known earlier, he said, "It's not about how you feel. It's about what's happening inside. Here's how you can lower your risk. Know your numbers: blood pressure, A1C, cholesterol. Take medications as prescribed, quit smoking and reduce alcohol. Get regular movement, even short walks count. Manage stress and talk to someone. Connection matters more than you think. Check your heart rhythm, especially if you ever feel fluttering or racing. Because every small habit today is an investment in tomorrow's clarity, strength, and independence." We've talked about the signs. We've talked about the risks. But what do you do if something happens? In our final section, we'll walk through the first 10 minutes after a stroke: what to do, what not to do, and how those moments can mean the difference between full recovery and life-changing loss. It was a quiet Tuesday morning when Donna noticed her husband, Mark, wasn't answering her. He was sitting at the kitchen table, looking at her, but his face looked off. His smile was crooked. His coffee cup had spilled. "Mark," she asked. He tried to speak, but the words didn't come out right. He raised one hand, but the other just sat there. Donna didn't panic. She didn't wait to see if it would pass. She grabbed her phone and called 911. Why the first 10 minutes matter most. When someone is having a stroke, the clock isn't ticking, it's screaming. Every minute, the brain loses nearly 2 million neurons. By the 10-minute mark, you've already lost cells that help with movement, speech, memory, and emotion. But here's the good news. If you act fast within that first golden hour, there's a high chance that doctors can stop the stroke, dissolve clots, and minimize long-term damage. That's why those first 10 minutes after noticing symptoms are the most critical window of all. What you must do immediately: 1. Call 911 right away. Even if you're unsure, even if the person says they feel fine, let the professionals make that call. Time matters more than pride. 2. Use the FAST test. F. Face. Ask them to smile. Is one side drooping? Arms. Can they raise both arms evenly? S. Speech. Ask them to repeat a simple phrase. Is it slurred or strange? T. Time. Don't wait. Call emergency services immediately. 3. Don't give food, water, or medicine. Aspirin, often used for heart attacks, can make a hemorrhagic stroke worse. Only doctors can decide what type it is. 4. Note the time symptoms began. Doctors need to know how long the stroke has been happening. It affects treatment decisions. 5. Stay calm but move fast. Comfort the person. Reassure them. Keep them still and quiet. And let the paramedics do their job the moment they arrive. Thanks to Donna's quick call, Mark arrived at the hospital within 30 minutes of his first symptom. He received clot-busting medication immediately. By the next morning, he could speak again. A few days later, he was walking with help, but walking. His doctor told Donna, "Most people wait. You didn't." That made all the difference. You don't need to be a doctor to save someone's brain. You just need to be ready. Recognize the signs. React without hesitation. And remember, every second counts. Because in stroke care, the first 10 minutes can shape the next 10 years. We've covered the signs. We've seen the real stories. And now you're more prepared than most people will ever be. But there's one last step. In the final moments of this video, we'll pull it all together. What we've learned, what it means for your future, and how you can turn this knowledge into power for yourself and the people you love. Let's finish strong.